guys, this is Dr. Hub. Today we'll look at the immune cell antigens. The immune cell antigens, and which is detected by the monoclonal antibodies. So let's start the antigen designated and their normal cellular distribution. So we'll look at the antigen designated and the normal cellular distribution. So first is the primarily T cell associated. So the primarily T cell associated. So this can include the CD1 thymocytes and the Langerhans cells. Next is the CD3. This is going to be the CD3 thymocytes as well as the mature T cells. Next, it will include the CD4. What will include is the CD4, and this will be the CD4 helper cells, CD4 helper T cells, as well as the subset of the thymocytes. Then comes the CD5 T cells, and a small subset. This is a small subset, and it is of the B cells. Next is the CD8 cytotoxic T cells. So CD8 cytotoxic T cells, there is a subset, and a subset of the thymocytes. The subsets of thymocytes as well as presence of NK cells. So the primary T cell associated, it has 1, 3, 4, 5 and 8. Then we look at the primarily B cell associated. The primarily B cell associated. So B cell associated, what does it include? So this includes, there is CD10. So CD10 is nothing but the pre-B cell and the germinal center B cells Then comes the CD19. This is the pre-B cell and also the mature B cells, but not plasma cells. They are not plasma cells. Next in line we have the CD20. CD20 is nothing but the pre-B cell, and this is after the CD19 and mature B cells, but not plasma cells. So this was 20, but not plasma cells. Next we have the CD21. The CD21 is nothing but the EBV receptor. So it includes the mature B cells. Mature B cells are present. And the follicular dendritic cells. Next in line we have the CD23. CD23 is nothing but the activator mature B cells. Next is the CD79A, and this is nothing but the marrow pre-B cells and the mature B cells. Now we'll look at the primarily monocyte. The primarily monocyte or the macrophage activator. So this includes the CD11C granulocytes as well as the monocytes. Then it also includes the macrophages, and it is expressed by the hairy cell leukemia also. Next is the CD13 This includes the immature as well as the mature. So immature and mature monocytes, and also the granulocytes. Then comes the CD14. The CD14 includes the monocytes. Then the CD15, it includes the granulocytes, and the Reed-Steinberg cells and the variants. Next in line, there is also the CD33. So CD33, it includes the myeloid progenitus, as well as the monocytes. Next comes the CD64. CD64 is nothing but the mature myeloid cells. Next in line, we look at the primarily NK cell which is associated. So this includes the CD16 NK cells as well as the granulocytes. Next in line, we have the CD56, that is the NK cells and a subset of the T cells. Then we look at the primarily stem cell. The primarily stem cell and the progenitor cell which is associated. So this includes the CD34, and this is pluripotent. CD34 pluripotent, hematopoietic stem cells, and the progenitor cells of many lineages, and progenitor cells, and this is of many lineages. Next, we look at the activated markers. Activated markers, it includes the CD30, activated B cells, as well as the presence of T cells and the monocytes. So then there is also the Reed-Steinberg cells and the variants. Then we move on to the present on all leukocytes. So what is present on all leukocytes? So this includes the CD45. So this is all leukocytes, and also known as the leukocyte common antigen. This is LCD45. Leukocyte common antigen. Leukocyte common antigen is known as the LCA.